option for the gluteal region. So we're going to just totally cover this area up. And what you want to do is you want to feel the greater trochanter. So the greater trochanter is the head of the femur, the ball and socket joint, and that's, you can just kind of use your palm, kind of like circular friction. And this is the area for like the sciatic problems, so that's why you can even kind of hook onto the iliac crest here and kind of push into the glute region, because you don't want to push into them like this, so you want to have that little bit barrier. So you, again, you're going to kind of hook and push. And you can just kind of walk, or you can kind of twist. Again, you don't want to put pressure on any bony areas, so that's why you're going to find those areas beforehand. Kind of like circular friction. And if you want to expose any of the glute at all, you can just expose a little bit of like the lower glute area like this, and just kind of tuck it in. So if you need to, you can perform even kind of gliding the lower body like this. And again, find where the greater trochanter is. And it's a good idea just to look at those areas beforehand to make sure there's no bruises, because if there are bruises, you can let them know, did you know you had a bruise there? So you're not going to get blamed for those areas then. Okay, now I'm going to go to the leg. So I'm going to go like this, and then what I'm going to do is I'm going to lift up the knee a little bit and just do like a Roman drape here. So I just did a Roman drape like this. And if I want to get into more of the gluteal region this way, that's the way I'm going to get into there. So you can see here, that's where for the glute. And you can even kind of glide and do some techniques that way too then. But again, I just did a Roman drape, so I just kind of pulled it underneath. So they're not going to get any air at all. And it's just a lot more like compression techniques. So again, you're just compressing. I'm going to add some oil. Again, with the pressure, you want to make sure you're going towards the heart with more pressure, of course. And there's a Gluteus Minimus trigger points that can mimic sciatic problems. So it's right around the greater trochanter. That's where you want to concentrate on. So see if it's mimicking the kind of problems that they might be having. And there's also another problem, it's called pelvic pain. So in the fourth month or so, it's when the pelvic bone starts to expand, and it kind of mimics sciatic problems. So that's the area you might want to concentrate on a little bit too, is this area. And the sacrum too, if they're having any kind of cramps. So you can kind of push into the sacrum area. But make sure you're not pushing on the coccyx, of course. Make sure you know where that is. Coccyx, the tailbone. And then with this, you can just bring this over here a little bit more. Make sure it's more straight. But again, we're performing the techniques on this leg, but when you flip them over the other side, then you're going to perform the same techniques on the other leg then. And you can even perform dorsiflexion to stretch that area out too. For the calf area, so you remember that's a big area for them to have cramping. And you can kind of go like this, you can feel the peroneus muscles, the one that's mostly lateral here. You kind of glide over it. Or right here, the tensor fasciae lata, or a lot of people just say TFL. So depends how they're walking too. So this area might be really having a lot of problems because it's rotated out more and this muscle is more contracted. And again, it's a little bit of muscle and it's mostly tendon. So that iliotibial band, the IT band right here. So again, the TFL is just a small part of the muscle, but it connects into the IT band. That's what area you might want to stretch out a little bit or relax it a little bit in those areas then. And you can even perform some light gliding techniques once you're done. Again, these light nerve techniques are just letting you know that I'm done in this area, it's time to go on to another area. And whenever you're done, make sure you